Assalamu alaikum everyone. Welcome to DentoScope Studio, the official YouTube channel of DentoScope Institute of Advanced Dentistry. I am Dr. Rashid Hassan, the founder and CEO of DentoScope, and today I am joined by yet again by Dr. Naghman Zuberi. He is international guest speaker for us today, and he shall be teaching us, telling us about the licensing exam for overseas dentists in US. Over to you, sir.
Thank you very much. Uh, Actually, we will be discussing not only the exam, we will be discussing about the different opportunities which are available for the internationally qualified dentists in United States. So, because it's a better way to think about it, only exams are just after passing exams, then what are the other opportunities and what are the other avenues and you have to take and options available. So let's start now. Uh, we will discuss about how to acquire the dental license in the United States. First of all, there is a term which we use: accredited and non-accredited dental schools. There is a commission on dental accreditation, which is called CODA, the Commission on the Dental Accreditation. It serves the public and profession by developing and implementing accreditation standards that promote and monitor the continuous quality and improvement of dental education programs. Well, the Canadian dental schools and the American dental schools on the reciprocal agreement, they accept each other's degrees. So Canadian schools are also accredited, and anyone who is getting the degree from Canadian dental schools, they can practice after passing certain exams in United States without going back to school. But most of the dental graduates coming from any other countries, they have to go to the dental school after passing the National Board of Dental Examinations exam, which is INBDE now, which I'm going to explain to you. So let's see how different the dental studies in the United States or in Canada they are from rest of the world. First of all, high school. High school means 12 years of schooling, which we call the uh, metric plus two, or which we call the FSC or SSC or whatever, or A level, etc., etc. After that, they have to go to university for 4 years, and where they study the health sciences. During third year, or even some of them in the fourth year, they attempt an exam by American Dental Association, which is called DET. DET is also being conducted in Canada as well. So no matter you are taking the American DET or you are taking the Canadian DET, you can apply to the American universities or you can apply to the Canadian universities. After that, 4 years of dental school, and then you get either your DMD or DDS. And then you have to, like, during the third year, you have to pass your American boards. Previously, it was in two parts, the NBDE Part 1 and NBDE Part 2, but now it is only one, the Integrated National Dental Examination Board. So after that, once you are graduating, then you have to choose which region you would be practicing. And there are regional boards. Previously, every state, they had their own boards, but now like few states, they have the combined boards and they are called regional boards, like NERB, WERB, etc., etc. So what happened to the students who are coming after graduating from the non-accredited programs? They have either a BDS or DDS. It doesn't matter. Some of the countries, they offer, like Iran, it offers DDS. It doesn't matter that if you are having a DDS degree from non-accredited program, you will be dealt in the same manner as BDS dentists, the dentists who are carrying the degree BDS with them. Well, after you got your degree from back home, then you get your documents verified by two services, the ECE and the WES. Well, ECE is mandatory, but some of the universities, they want WES as well. Without ECE, American Dental Association is not going to let you write the INBDE exam. So first of all, get your documents evaluated from ECE. Meanwhile, also get your dent pin. Dent pin is the dental personal identifier number. It is a unique personal identifier for professionals and students involved with the US dental education system and standardized testing programs. Your for life, your ID with the ADA will be from your dent pin. Don't lose that and don't share its password with anyone. As I told you that previously there were two exams which were being conducted by the JCNDE, NBDE Part 1 and NBDE Part 2. But now, September 4th, 2020, the new exam was introduced, and that is INBDE. The NBDE Part 2 will be discontinued on August 1st, 2022. JCNDE conducts this exam INBDE now. It integrates content from the biomedical, behavioral, and clinical sciences to replace the National Board Dental Examinations Part 1 and Part 2. The purpose of this INBDE exam is to assist the dental boards in determining the qualifications of individuals who seek licensure to practice dentistry in the United States. Well, after passing that exam, before going to the dental school, you need to pass some English proficiency test. And that is standard exam is TOEFL IBT exam, not paper based, no computer based, only TOEFL IBT exam, which has four parts: the written part, speaking part, reading part, and listening part. So you have to identify which university you are applying and check out their requirements. Some of the universities, they want better speaking skills. Some of the universities, they want better writing skills, etc., etc. And you have to achieve these standard. If you acquire a score more than 104, 105, then you are in the safe zone. But anywhere between 100 to 105, you are okay. But below 100, don't expect any call from the dental schools. So that is my observation in the last 15, 16 years since I am watching this whole system, and my students, they are applying in different universities. So that is what I saw. Well, then you have to apply to the universities. There are two types of universities. One is they are being governed by a centralized intake system, which is called CAPID. And other universities, they have their own websites, and you have to apply using their portals and websites. That those are called non-CAPID universities. So CAPID is one portal, and you can apply to various universities, and they like throughout the year the programs are being offered. You have to make your profile on the CAPID. What is this ADA CAPID? The ADEA CAPID, application for advanced placement for international dentists. It is available to all the individuals applying to the participating programs. Applicants to ADEA CAPID are internationally educated dental graduates who wish to practice dentistry in the United States or Canada. ADEA CAPID includes advanced standing programs which are typically shorter in length. Shorter in length means like not 4 year, either 3 year program or 2 year program, because you will be inducted either in second year or in third year. So shorter in length compared to the traditional DDS or DMD degrees. So what you want on the what you have to do on the CAPID application portal, you have to make your profile, then electronic letters of recommendation, they are going to be uploaded. And keep in mind, one letter should be from the dean of your dental school. It doesn't matter if the dean was there when you graduated or not, but the school you have attended, you need one letter of recommendation from the dean of that school, like the principal of that school. The reason is they want to confirm whether you attended that school or not. So it is one way of confirming it. Then you have to write your statement of purpose, which we call SOP. This statement of purpose, it actually your marketing skills for yourself, how you are selling your abilities, your achievements, how you are highlighting all these details, and how you are making yourself more acceptable to the program. So there's all like very you can say uh, it should be very properly structured essay about yourself and your like highlighting your abilities and your achievements. Then the TOEFL score, which I have already mentioned, and your NBDE exam result, your ECE evaluation, which I told you in the beginning, and then you select the program from the list available. Supplemental applications are also being required by some of the universities, not only the CAPED. And once you submit the application through CAPED, then you get an email with the supplemental application material. So it would be an application form, which could be paper based, which you download and you fill it, and then you have to send it to the university, or it could be an electronic application form. Letters of recommendation, again, some of the universities, they say, okay, those three were generalized letters of recommendation. We need three recent letters of recommendation from the people, like some of the people who have already migrated to Canada or United States in the last 3 4 years, and now they are struggling with the system and they want to apply. So the people with whom you've been interacting over here, like maybe as a dental assistant, or you as a dental hygienist, or whatever, you are working, or even in like any capacity you are working at some odd jobs or some office work or whatever. So they want letter of recommendation from those people, that what are your abilities, what is your aptitude towards the learning, how good your learning skills are, etc., etc. So all those should be highlighted in those letters of recommendation. Then the supplemental application fee, you have to pay the fee to cap it for the for applying to one program. But then again, supplemental application fee is also being asked by the university. And like at times they ask you about other things, like write down some what do you call it, reference letter, like you are sending a patient as a referral. They give you a case scenario that patient is having some generalized periodontitis and one tooth is missing, and you want to send them to the specialist for firstly period procedure and then for the implant or whatever. So how you will write down the referral letter, all those things, they will ask you certain things like that, just to uh, you can say shortlist the most eligible students. Well, after that, if you are shortlisted, then they will call you for the interview. It could be just an interview, it could be just a bench exam, or it could be both of those, like interview and bench exam. So it depends again from university to university where you are applying. Well, after that, you will be selected finally. Well, a lot of finances would be required. You can use your own funds, but of course it is very expensive. Banks, they also offer loans for the dental studies in United States, even if you are a Canadian citizen or Canadian PR card holder. So Canadian banks can also offer you loans to go and study in the United States, and then you can pay them back. But you will definitely need a co-signer who would be working. It could be your blood relation, it could be your spouse, it could be your like brother or sister or whatever, or even a friend. So but a co-signer will be required. After that, you complete your degree, and then you go for the regional boards, and then you can start practice. Well, this is the one way of getting integrated into the American system. Well, some of the people, they say, no, we don't want the DDS degree. We want to go for the specialization. We have already spent a lot of time in master's degree in back home, or in like fellowship, or maybe we did our MFD from England, or like things like that. So we are just interested in the residencies, and we will go for some master's degrees or maybe for the diplomate exams, and we will be considered as a specialist here in United States. For those students, after passing your INBDE exam, then you and TOEFL exam, then you apply through another portal system which is called ADEA Pass system. The American Dental Education Association Postdoctoral Application Support Service. It is a centralized application service for individuals applying to advanced dental education programs. ADA Pass simplifies the application process by allowing applicants to complete one standardized application rather than sending many applications to each individual program. But mind it, these programs are very, very highly competitive. Well, as I told you that you have to do the appropriate tests before application like INBDE, or if you already have NBDE Part 1 and Part 2, on the basis of that you can apply. Then TOEFL, GRE, some of the universities, they want GRE. That is unofficial self-reported test results only. GRE has different types of tests. So this one is required by the universities which are participating in PASS. Then ADET. Some of the universities, they want ADET. ADET is also required by some of the universities for DDS as well, like by the Michigan University. That is the Advanced Dental Admission Test. It is an admission test designed to provide advanced dental education programs with a means to assess applicants. ADET is also now a requirement by two of the Canadian dental schools for DDS, international students who are going to do the DDS, that is McGill University and University of Toronto. After you go into the this residency program and you pass your residency program, then you are eligible, you get the degree from the university, and you are eligible to appear in the exam of diplomat of the American boards. It is the board certification, means that the specialist has met the highest requirements of competence within the specified field. Achieving the status of board certification demands an immense amount of dedication and hard work beyond the regular rigors of specialization education. Well, some of these students, they ask me, or some of the aspirants, they ask me, can we just get the license directly in some of the American states? Yes, that is available in few states only, but on the individual basis after seeing your academic record, your clinical expertise, if you have written some articles in the journals like journals of repute, or if some of the people who got the direct license, they were coming from England after passing their MFD exams, FFDS exams, or after attending 2 years of the clinical programs, not the taught programs or theory programs or research programs, clinical programs. Then, after passing INBDE exam, then you go to the state board the authorities and tell them that I want to practice in your state, and you offer these direct license to the internationally qualified dentist. Please assess my documents and my credentials. They will do that. If they find you that you are eligible to practice dentistry without going to the dental school, so for that state, they will say, okay, go and appear in the regional boards and we will give you the license. Firstly, at times, what they do, they say, okay, you can work under supervision. So you can join some dentist. You will work with them for a couple of years and then you can start your own practice as well. But it is not available to every individual. Keep in mind, I have seen like probably 2 out of 100 cases. That's it. General dental residency programs for foreign trained dentists. That is another option. The advanced training program for foreign trained dentists does not focus on a specialization, but rather all subjects taught in a dental school. It is basically a bridge course, making an international dentist equivalent to any US trained dentist. So, with this program, you will repeat 2 years of dental training to be eligible for dental licensure in the United States. These general dental practice dental residency programs, they are being offered by various universities, and at times, like, you have to do a research on that, because some of the programs, they are just there for uh, like once or maybe twice, and then they've been called off once they find out that, okay, the requirement of dentist in our area is fulfilled. So Howard University, Tufts University, Metro Health Medical Center, Abington Memorial Hospital, these were the centers which were offering these type of general practice dental residency programs in the past. But these programs, they are being announced and then they've been called off from time to time. So you have to keep an eye on these different exams. Some of the centers in Florida, they also announce from time to time these programs. They only take like one or two dentists in like 1 year's like for the one session. Well, as I always say, choose your path wisely, and there is no shortcut to. If you are looking for some shortcut that I will just go to United States and I will be a licensed dentist within no time, it is not like that. A lot of money, a lot of effort, and a lot of hard work, and then definitely a bit of luck also play a very vital role. So choose your path wisely. I always tell my students that do not leave any stone unturned. What do you Various paths are available, various uh, avenues you can go on. I think do not leave any option. If, like, apply to that, apply to this, apply to if you have some master's degree from back home or fellowship from back home, you can even apply to the specialization programs as well, because maybe you won't be lucky to get into DDS program, but probably you would be lucky to go into the master's program of your choice or of your interest. So you can do that as well. So this is my advice, and any other further query, any further inquiry, any further discussion, you can always contact me. I am available to all of you, all the people who are coming in, because I myself gone through all that phase, and I know that it is very tough. So I am available to all of you, and I would love to help anyone who is going to reach me. So thank you very much for listening, and over to Dr. Rashid.
Thank you so much, sir, for sharing such knowledge and your experience with the viewers. It was indeed very much knowledgeable. Anyone who wishes to take this exam, well, I have a questions. Are these exams preparation being held in Pakistan as well?
We
Somebody
can
who
do
can,
that. We can arrange that. I'm doing it for the last, you can say, 14 and a half years now. And
right,
I started online. Like, you can say that I was the pioneer in online dental education for these type of exams to make the people prepared. I was preparing students for LDS England. I was preparing for the ADC Australia, and then of course for Canadian exams and American exams. And
right,
still I am doing it for the last 14 and a half years. So
right,
we can. I have some students from Pakistan at the moment. I have students from India. I have a student like all over the world. When my class starts, which is going to start like in another 20 minutes now. So
right.
the students who join me, like, it is almost an international forum. I have students from all, like 85 students are going to join, and they are like from all over the world. So they're without any discretion on the basis of creed or religion or race, nothing. I am available to any person who is attempting these exams. So we can like make a specific program, and we can design
Right.
it for your students as well, or the people coming from through DentoScope. We can
Yes,
make a
sir.
program, and we can definitely. And my idea is not only to just make you pass the exam or just deliver the lectures. It is a complete mentorship, because my experience of these 14 years, and even before that, back home, if you remember, I was one of your colleagues, and over there,
Yes, sir.
even I was guiding the students to get admissions in different universities. So I can
Yes, not
help.
only admission, but regarding the exams, also you were
Yeah,
guiding
yeah, I was
way past
guiding them, I was
14, 15
providing
years
them the
back
notes
also.
and all that. Yes, so I can do
Yes,
that. We
yes.
can conduct a course, and alhamdulillah, I can proudly say that for the couple of years, my INBDE, the American board results are 100%. My EDAT results are also 100%, and with very good, like in the top performer students, my students are, alhamdulillah, by the grace
Right.
of God.
Yes, sir. I have seen the results.
Yeah.
I always see them on Facebook.
Yeah,
That
and even
Alhamdulillah,
your
hundred
sister
percent
was
of the
also
candidates.
my student, and she's going to be
Yes,
a
sir.
dentist soon.
Yes, sir. Yes, sir. I know. So yes, we can
We can
arrange a
arrange, yeah, we
course.
can arrange
Yeah, an
something,
online
inshallah, soon.
course
Yeah,
for
from August we can start
INBD.
it. Yeah, I'm starting my new session from August, so we can start from August, and inshallah, if I have to travel for a couple of days to
Yeah.
do the setup over there, I can definitely come over, and we will do a setup in both of your centers, like the Rawalpindi Center as well as in the Lahore Center. And then I will be conducting the lectures from here in Canada, and we will do that.
Right, sir. Thank you so much, sir. We
Thank
will,
you very much.
inshallah, I will stay in touch with you, and we will definitely try to formulate some preparation classes
Definitely,
for
definitely,
these overseas
inshallah.
exams, because lots of students, Alhamdulillah, DentoScope has trained more than 700
I
students in the
know, I
past
know.
three
I
and a
have
half
seen
years.
you growing,
Yeah.
mashallah, and I'm very much happy and very much impressed by your performance.
Alhamdulillah. And most of, especially the youngsters, they are very much reluctant, because as you know, sir, there is no career counseling pathway
Well, any
in Pakistan.
career counseling, if you remember, even when I was there in the dental schools in Pakistan, I was doing it because I had, mashallah, a lot of exposure. I was traveling abroad, like to different countries, and getting all the information from here and there, and attending the short courses all over the world. So I was doing it, and I'm still doing it, and I would love to do any type of career counsel. I can even suggest them that which path would be good for you, keeping their uh, what do you call it, uh, circumstances in mind.
Yes.
And it would be like on individual basis, inshallah. And I don't charge anything for that. It is all free. There's career counseling, choosing the path and letting them choose the path, that is all free. I don't charge for those services.
Because indeed these foreign exams are really very tough, and
They are tough, no doubt they
yeah,
are tough,
and
and
we
the
don't
way,
have any
yeah,
anyone guiding us here for those exams.
yeah.
So it would be great help if we could arrange
Yeah, yeah, yeah. And even
courses.
we can arrange some sessions for the bench exams of the universities in Pakistan as well, because you have the facility.
Yes,
So we can do it on like the typodont practices, and how to write the essays, and how to write the consent letters, and how to write the referral letters, and all those, and how to write the prescriptions from American and Canadian perspective, because these are
yes.
the things they really
These
see in.
things seem very minor, but they play a very major role.
Very
Yes,
major
yes,
role. And of course, a minor flaw in your letter of reference, or in like this consent, or even a minor flaw in your prescription writing, probably you will lose the chance to get admitted for that particular year.
yes, exactly, exactly, sir. So, thank you so much, sir, once again for your time. I know you have a class
Yeah, I
for
have to
your
start my class
students
now. And
in
thank you
ten
very
fifteen
much,
minutes.
everyone. Allah Hafiz. And I'm available to all of you. Just I'm one call away, or one, what do you call it, inbox message away. I will definitely respond to you. Thank you very
Sure,
much.
sir. I'll stay in touch with you, sir.
Thank you.
Thank you
Allah
so much once
Hafiz.
again.
Allah
Allah
Hafiz.
Hafiz.